Welcome, everybody. This is Nurse Eunice with Florida Training Academy, and we're going to get started with our CNA and PCT review on caring for a patient with body lice. And we're going to get started in a few moments. Make sure that you get your notifications. If this is your first time here, let us know where you are viewing from. And if you need additional assistance with your CNA or your PCT examinations, our website is fltraining.com, and it will also be shown on the screens below in a few moments. Hello, Ashma. Good morning, good afternoon, good evening, depending on where you are in the country. We're going to get started in a few moments. Hope everyone's having a great day. All right, and so let's talk about body lice. So body lice, also known as Pediculus humanus corporus, are small oblong insects that infest humans. They're parasites, which means they live around the body and feed on blood. They are relatives of head lice, but prefer to inhabit clothing and only move to skin to feed. So this is not the lice that's typically found in the hair or on the hair follicles. Body lice have a long abdomen, 6 legs, strong claws on the bottoms of their legs that allow them to hold on to a host, you or your patient, and sharp mouth parts that can pierce the skin to feed on the host blood. They can't fly or jump, so they travel by crawling. And this is an example, an illustration of a person who's been bitten by body lice. Body lice are spread through close contact with other people who have become infected with the lice. They live in the seams and folds of clothing. They can live in clothing for up to 1 month. Symptoms of body lice includes bites, itchy and irritated skin, small discolored bites, bumps, and or rashes on the skin. And hello again, everybody. We're going to go ahead and get started with our review. Today, we are going to be taking care of a patient named John Davis. He is 55 years of age. Gender is male, medical history, homelessness, alcoholism, and hypertension. And his current medications are lisinopril, which is a blood pressure medication, multivitamins. His living situation, as we said before, he is homeless and he stays in shelters or on the street. John Davis is admitted to the hospital that you work at with severe itching, red bite marks, and a rash over his body. Upon examination, he is found to have body lice. Body lice infestations are common in individuals with poor hygiene or who live in close quarters, such as shelters or jails. John requires special care to treat the infestation and to prevent its spread. And there you are. You're the PCT or the CNA that is assigned to care for Mr. Davis, and let's see how you do. Number one, what is the first step a healthcare worker should take when caring for a homeless patient admitted with body lice? A, offer the patient food and water. B, assess the patient's overall condition and document the findings. C, isolate the patient in a private room. Or D, provide clean clothing and bedding. And we like to have interactive reviews, so please put your comments in the chat area and we'll start reviewing those and we'll reveal the answer in about 3 seconds. So I see D's, I see a B. Anyone else? Hey, Denise from Atlanta. Rafi says B. All right, so this one was tricky. There we go. Great job, Vernette. Vernette is the first one who said we had to put that patient in an isolation room. So, C, we're going to isolate the patient in a private room. And the rationale is that isolating the patient in a private room is the priority to prevent the spread of lice to other patients and healthcare staff. After isolation, further assessments and care can be provided in a controlled environment. Question 2, which symptom is most indicative of body lice infestation? Is it constipation, dry mouth, severe itching, or increased appetite? If your patient has a body parasite that's on their skin, what symptom will they be complaining of? And if you said, see, great job, everybody, severe itching, you're absolutely correct. So, itching, especially at night, because the bugs like to come out at night, is a common symptom of body lice infestation. And hopefully, you never have a patient with body lice, because if you ever do, whether there's a lice on you or not, you always feel as if something's crawling on you. So you want to make sure that you isolate that patient. And in a few moments, we'll talk about the proper PPE. Question number 3, what should be done to help confirm the diagnosis of body lice? Remember, patient care techs, CNAs, and nurses, we don't diagnose, but we gather the data that the doctors use in order to diagnose the conditions that the patients have. So, would it be A, conduct the blood test, B, examine clothing and bedding for lice, C, perform a chest x ray, or D, measure his blood pressure? How do we help confirm the diagnosis of body lice? Yes, this is an easy one. A favorite girl named Shannon, Ashma, Fatima, Vernette. That was easy. It's going to get harder. So, yes, that was B. Examine the clothing and bedding for body lice. And when you're examining everything, when you enter that patient's room, just be mindful of what you're wearing. So, if you suspect the patient has something contagious or an infestation, you want everything covered up. Question number 4, which intervention is most important to treat John's body lice infestation? Is it A, administering antibiotics, B, applying topical insecticides, C, providing intravenous fluids, or D, using antifungal creams? And this isn't about what you can do as a CNA. Remember, this is about the team. So, what do you expect the nurse to administer for a patient who has body lice? I'm so proud of you all. Yes, it is insecticides. Great job, team. So, B, the nurse is going to apply a topical insecticide because they are used to kill the lice on the body and are a primary treatment for infestations. And as a reminder, topical medications such as an insecticide must be applied by a nurse. So, at least you know what the treatment is, but it's the nurse's job to perform that intervention. Question 5, what should be done with Mr. John's clothing and bedding to prevent the spread of body lice during the hospitalization? So for this one, take the bedding out. Just the clothing. This person was homeless. They're in your facility now, and they have a suspected infestation of body lice. Do you want to do A, dispose of the clothing immediately? B, wash them in hot water and dry on high heat. C, spray them with disinfectant. Or D, store them in a sealed plastic bag. Actually, it says sealed plastic bags with an S on the end. What do you want to do with his clothing, his coat, his hat? I see a lot of B's. I see a lot of B's. Anyone else? I see an A. And everybody, if there's an exam, you cheat off of Vernet. Just joking, we don't cheat here. But yes, because look here, my CNAs, my patient care techs, you have enough to do. You are not doing laundry. So what you're going to do instead is if you suspect someone has an infestation, you're going to do D. You're going to store their items in sealed plastic bags. So this is an example of a personal belonging bag. And it does have a drawstring up top. So what you do is you put the items in the bag and put that bag inside of another bag. So all belongings will remain tied in double plastic bags until the patient is discharged. Patients should be strongly discouraged from entering the bag with personal items while in the healthcare facility unless there is no other alternative. And if a family member comes, you can give them the bag and then they can go and clean everything according to the standards. Question number 6, before entering Mr. Davis's room, what is the most important practice to prevent the spread of body lice? Is it A, using alcohol-based hand sanitizer, B, washing hands with soap and water, C, wearing gloves and a gown, or D, applying lotion to his skin? want to prevent the spread? Fatima has it. Look, you can wash your hands all day long. But if that patient has body lice and they get on your clothes because you didn't wear gloves and a gown, your hands are going to be clean, but your body's going to be miserable. So, in addition to washing hands, what you must do absolutely is put on the appropriate PPE if a patient has a body infestation. So C is the correct response. Wear gloves and a gown. Of course, if you have longer hair or you may have a beard, so they have caps for your hair. They have shoe covers. You want to do whatever necessary to protect you and to prevent that spread of lice throughout the facility and in your own home. And so this is another sign. So when we say we put someone on contact isolation, this is a sign from the CDC. So whenever you're, curious about what current protocols are, and notice how I use the term current protocols, because sometimes you're going to have questions, something may have changed, and you want to know the why. Go to cdc.gov. So that's the Center of Disease Control, cdc.gov. And here's an example of a contact precaution sign. And this one says everyone must, and this is usually placed on the outside of the patient's door when they're on isolation. They must clean their hands, including before entering and when leaving the room. Providers and staff must also put on gloves before room entry, discard them before they exit the room, put on a gown before entry and discard it before they exit the room. And it says, do not wear the same gown and gloves for the care of more than one person. So if there's a shortage of gowns, you would have to store that gown in the room, usually near the door, and you would put that gown back on whenever you re-enter. And then lastly, notice the picture of the stethoscope. It says use dedicated or disposable equipment. Clean and disinfect reusable equipment before use on another patient. Look, if a patient has lice, we're not taking items out of their room and then taking them into another room. So they should have disposable equipment, and that should help you with a future question. So question number 7. Mr. Davis has an activity order that allows him to be up, that should say ad lib, up ad lib, ad lib, while in his room. Given this order, what type of personal hygiene would be most appropriate for a patient with body lice? Is it A, a bed bath with special attention to affected areas? B, shower with medicated shampoo and soap? C, sponge bath with regular soap? Or D, no hygiene needed? Allow the patient to rest. So you have to know what up ad lib means so that you can choose the correct response. Hello, Shelda. All right, let's see. And I see the correct answer. Ashma, yes. So, all right, so this is a little bit tricky because I told you that a CNA can't give medication. So, what we would do instead is the nurse will provide the patient with the medicine, the shampoo, etc. And you, as the CNA, would be monitoring this person while they're showering. So, up ad libs mean they can get up independently, they can move about their room. They may need an additional shower order depending on what facility they're in. But if this person has lice, scabies, anything like that, we're going to try to make sure they get a shower order because they need to shower. And you're going to be in there monitoring them to make sure that they hit all the pertinent areas, that they do what they're supposed to do with the medication. So it's not you using medication on the person. The person's using the medicated shampoo independently while you're supervising them. So I hope that helps you understand this question better. And here we go. They're going to medicate. They're going to shower with the medicated shampoo and the soap because that's how we're going to we're going to cleanse the skin and remove the body lice. And typically, once they use their medicated soap and the medicated shampoo, the body lice start dying within 24 hours. Question number 8. Why is it important to monitor John's skin condition closely? Is it A, to check for signs of dehydration? B, to assess for allergic reactions? C, to monitor for secondary infections? Or D, to document his skin texture? And when we say monitor closely, pretty much every shift there should be another skin assessment. And the person who spends the most time with the patient is, of course, the CNA. So you're going to notice that something is wrong with their skin before the nurse will in some instances. So why are you monitoring his skin? And everybody got this answer correct. I am so proud of you. Everyone seems to have chose C. You're going to monitor for secondary infections. And look at that boil. So scratching due to lice, dirty fingernails, they're scratching their skin, plus the bugs have germs. They can lead to other skin infections. Question number 9. Mr. Davis is scratching his skin frequently. What should the CNA or PCT do? And if you don't know what a patient care tick is or a PCT, that is the common term for a hospital level CNA. So if you're a CNA, because of the limitations of your license, if they need you to do more than what a CNA can do, usually the hospital won't hire you and call you a CNA. They're going to hire you in a role of a patient care tech or a patient care associate, and they're going to teach you more tasks and you will be able to do more. But for your test, any test that you take, whenever you're trying to become a CNA, you're not a PCT. You can't do any advanced techniques. But going back to this one, if you are the CNA or the PCT and he's scratching his skin, do you want to do A, ignore the scratching, as it's a common behavior with lice infestations? B, offer the patient an over-the-counter anti-itch cream? C, report the observation to the nurse for further assessment? Or D, provide the patient with a towel to cover the affected area? It can't be D, because we know that lice like to live in clothing and increases. So if you just give him a towel, the lice are just going to go into the towel and that's going to become infestated too. So yes, everybody, it is C, reported to the nurse, because frequent scratching could indicate discomfort or worsening infestation. The CNA should report this to the nurse so that appropriate interventions, such as the application of medicated creams or additional treatments, can be considered. 10. How should a CNA handle the cleaning and disinfecting of the room while caring for a patient with body lice? All right, so he's been touching everything. His clothing hit the floor. You had to pick it up. What are you going to do? Is it A, leave the cleaning to the housekeeping staff without any precautions? B, use cold water and mild soap to clean the room? C, only clean the areas that the patient directly touched? Or D, disinfect all surfaces, including the bed, chair, and the floor? Oh, Ashman, Fatina, they were fast on this one. Yes, everybody, we have to clean. It's going to be D. And for my future nurses, if you ever think you're too good to do something, get out the medical field. We all need to clean. So we clean, we take care of the patients, we do what's necessary. It's how we clean that's different. So we usually don't use bleach, anything containing bleach on our floors, because a patient could be, they could be sensitive to the smell of bleach. So we have these sandy wipes, or we have some type of wipe that has a chemical agent that doesn't have a strong odor that we can use to clean surfaces. So the answer is D. You're going to disinfect the surfaces as much as you can. And then whatever you can't get up, that's when you would notify housekeeping for them to come in and clean up the rest of the spill or to clean an area that just doesn't look right. Question number 11. What is the most important consideration when using a blood pressure cuff on a patient in contact isolation? Is it A, use a disposable blood pressure cuff for each patient in isolation? B, share the same blood pressure cuff between patients in isolation? C, clean the shared blood pressure cuff with wipes before use? Or D, avoid using a blood pressure cuff altogether? So you're just making up blood pressures if you do D. So D is definitely not the right answer. Yes, everybody. Yes. So here's an example of a disposable cuff. So whenever you have someone with isolation, they should have their own supplies. So the answer is A. Using a disposable blood pressure cuff for each patient in contact isolation helps to prevent cross-contamination and the spread of infestations. Disposable cuffs are designed for single patient use and should be discarded after use. So when we say discarded after use, what you'll normally see is a disposable cuff will we'll just wrap it around the side rail, or we'll put it somewhere so that we can easily assess it. So when we say discard after use, we discard it whenever it becomes worn, whenever it becomes soiled, or whenever the patient is discharged. So that's what we mean by after use. So you wouldn't just use it one time and throw it away. You use it for their entire stay. Question number 21. What is the best practice for taking a temperature on a patient in contact isolation? A, use thermal temperature measurements to minimize contact. That's like the forehead scanners. B, share a thermometer between patients, but clean it at the end of the day. C, use a thermometer without a cover to save supplies. Or D, use a thermometer with a thermometer cover. And this one's going to be tricky. I knew a lot of you all were going to say A. Imagine if you took the thermal scanner, the thermometer, into a patient's room who had lice. Where are you going to put it at? You're going to put it in your pocket? So give me a more cost-effective option, because a thermal thermometer is not disposable. Yes, so D is the better option. So D, we're going to use a disposable thermometer with a thermometer cover. They're little cheap thermometers. And so you would keep this in the patient's room, and just like with the blood pressure cuff, when they're discharged, we just throw it away. 13, the case manager has located Mr. Davis's daughter. Mrs. Davis's daughter is allowing him to move in with her upon discharge. Remember, he was homeless. What is the best way for her to handle his clothing and personal belongings? A, place the clothing in a plastic bag and send it home with the patient. B, dispose of the clothing and belongings immediately. C, wash the clothing and belongings in hot water and dry them on high heat. Or D, leave the clothing and belongings in the patient's room. All right, we have to educate her on his diagnosis, and also on, ways that she can prevent a lice infestation in her house. So what should she do? Ooh. Well, we put it in a bag. What should she do at home? So it's not A, that's what we did. So now that she's home, what should she do? Yes. I'm saying the correct response is coming through. So I didn't tell you that his daughter is pregnant. So whenever she gets her father home who has body lice, she needs to wash that bag of clothing that we collected. She's going to wash the clothing and the belongings in hot water and dry them on high heat settings. And that's going to kill the lice and their eggs and reduce the risk of reinfestation and prevent the spread of lice in her home. Question number 14. What advice should you give to Mr. Davis to help prevent future body lice infestations? A, use alcohol-based hand sanitizer frequently. B, wash and change clothes regularly. C, avoid public places. D, wear a mask when in crowded areas. This one is easy, but I need you to consider his situation. So yes, everybody, the answer is B. But if you have somebody who's homeless, because even though his daughter may have let him in to her home, at some point he may decide that's not where he wants to be. There's too many rules, there's too much accountability. He also has a history of alcoholism, and she's pregnant. So there's a lot of factors going on. He may decide that he doesn't want to be in her home. So you still want to educate him about washing and changing clothes regularly. So in your community, there should be some type of resource, whether it's another homeless shelter. Sometimes when it's cold, they have areas where they can go and warm up. They can get clothes from the Salvation Army, from Goodwill. So be thinking about that. And also charitable organizations such as churches. So be thinking about that. If you're telling someone to change clothes regularly, but they're homeless, where are they going to get the clothes from? 15, what is the primary mode of transmission for pubic lice? So what is the pubic area? All right, so is it A, sharing clothing or bedding? B, close personal contact, often sexual? C, using public transportation? Or D, handling contaminated food? So just like there are body lice, There's a different type of lice that likes the pubic region, so the genitalia. What's the primary mode of transmission for pubic lice? And yes, looks like Barb says B and A, but everybody who chose B, you're correct. So all right, so close personal contact, often sexual. And if you're sharing clothes with somebody who has pubic lice, you can also get it. So, pubic lice and sitting on some toilet seats. Oh, wow. So, pubic lice, also known as crabs, are primarily transmitted through close personal contact, including sexual activity. They infest a coarse hair in the pubic area, but can also be found in other coarse body hair. For example, armpits or butt crack, wherever there's a lot of hair at. So if you suspect your patient has pubic lice, of course you're going to get the nurse and we'll go in and assess it, but we may have to shave that area in order to get rid of some of the lice infestation. I know, gross. Question number 16. How do body lice differ from hair lice in terms of their living environment? Is it A, body lice live in the hair while hair lice live in clothing? B, body lice live on the skin while hair lice live in the ears? C, body lice live in clothing and bedding while hair lice live on the scalp? Or D, body lice live in, it should be public places while hair lice live in homes? Well, D just doesn't make any sense. And I expect for everyone to get this one correct. So if you chose C, that body lice live in clothing and bedding while hair lice live on the scalp, you are correct. And so this is an example of a tool, so like a brush that you can use whenever we suspect that a patient has hair lice. We have to go in and get out the lice and also their eggs. And so usually tools like that you can purchase them on Amazon, but you can also get them from your local pharmacy. Question number 17. Another homeless patient with body lice has arrived to your hospital. You all, there is a large population of, if they're not homeless, we're going to call them unhoused, because there's a large population of people who are currently living in their vehicles or they're living in tents. So they may not be homeless because they can call their tent their home, but at the end of the day, they don't have a brick and mortar location to lay their head. And so we're covering this body lice because there are infestations going around of various illnesses. So 17, another homeless patient with body lice has arrived to your hospital. She is reluctant to receive care due to feeling ashamed. How should the CNA approach the situation? A, tell her about your other homeless patient named John. B, acknowledge the patient's feeling and offer support without judgment. C, dismiss the patient's concern and proceed with care. Or D, advise the patient to leave the hospital if they are uncomfortable. If you do D, go ahead and give up your license. You do not need to be in healthcare. We need people who care about people. So if you care about people, you're always going to acknowledge their feelings. You're going to do B. Acknowledging the feelings and offering non-judgmental support can help build trust and encourage the patient to accept the necessary care, which could be a referral to a shelter, a referral to a woman's facility. Compassionate communication is key in addressing the emotional needs of the patient. Remember, we are there to serve the patient. Question number 18. You're doing such a great job taking care of this patient and also the others on your floor today. So question number 18, how can a CNA help reduce the stigma and embarrassment a patient might feel about having body lice? Is it A, treat the condition as a routine health issue and maintain a non-judgmental attitude? B, discuss the patient's condition openly in front of others to reduce stigma? C, ignore the patient's concerns and focus only on the physical treatment? Or D, allow the patient to avoid treatment to prevent further embarrassment? That's right. We're not going to treat this as anything different. This is routine. This is normal. We're going to do A. We're going to treat the condition as a routine health issue. Look, lice has been around for hundreds. I want to say at least, 1,000 years. They were back with the Egyptians. So allegedly, Cleopatra, she was buried with a golden lice comb. So lice have been around just as long as roaches. So we're going to treat body lice as a routine health issue, and we're going to maintain a non-judgmental attitude to reduce the stigma and embarrassment. Question 18. What is a common secondary infection that can result from a body lice infestation due to scratching? Is it herpes simplex virus 1 or HSV1? Is it impetigo? Is it influenza or is it cellulitis? What is a common secondary skin infection? I see A's. I see a D. Anyone else? I see a C. Oh, you all are all around the alphabet on this one. So I'll reveal the answer in 3, 2, and let's go back. It is D. So I think there's another option. Impetigo would be one, but impetigo is not one of the most common ones. So cellulitis is a common secondary bacterial infection that can occur as a result of frequent scratching, which breaks the skin and allow bacteria to enter. Body lice infestations can often lead to intense itching and scratching, increasing the risk of cellulitis or inflammation/infection of the skin. 20. What is a potential severe complication of untreated secondary infections from body lice that spread to the bloodstream? Is it sepsis, gastroenteritis, viral meningitis, or strep throat? They scratched, they scratched, they scratched. They develop cellulitis untreated, the bacteria into the bloodstream. What is it called when there is an infection in the blood? I see a lot of A's, I see C's. All right, so viral meningitis would not be the correct response. That could be transmitted by other means. If something's in the blood, we call that sepsis. So, sepsis is a severe and potentially life threatening condition that can occur whenever the body lice or the germs from the body lice spread to the bloodstream. This requires prompt medical attention to prevent systematic complications. When a patient becomes septic, they are really sick. Okay, so that's a life threatening condition, and we want to prevent that. You all have done marvelously. I know this is a little bit of an odd topic, but I need to cover it because the first time that you have to take care of a lice patient or a patient with lice, excuse me, I want us to have ran through this online, thought about it. And then that way, when you get somebody, you know what you have to do. So we're going to do personal hygiene. We're going to make sure they're bathed. Of course, we're going to change their clothing. We're going to put their clothes in a bag. We're going to clean that environment. Don't forget that they need to be in an isolation room and that you need to have on your PPE. You're going to follow patient education and provide emotional support. Imagine someone who is just closed up in the room all day. They can become depressed. And then you're going to observe and you're going to report any findings that are important to your nurse. And if you do these critical tasks and helping to manage the patient's condition will help prevent the spread of lice, and ensure that the patient receives compassionate care. Again, that's our job. And so you know how we end everything. This is Nurse Eunice. I will stay around for a few minutes just to review the comments to see what questions you all have. And I love you. You all know I pray for you. And we get so many messages saying that you all are passing your test, etc. And so again, we appreciate you. We thank you for watching. And even though I will just have the screen up, I am still here in the comment area answering whatever questions you have. And I'll do so for the next 2 minutes. So I love you. See you in the next video. And I'll see you in the comment area. So what questions do you have, everybody? And you're welcome, Burnett. Oh, Fatima, I will tell my mom you said, hey, thank you so much. All right, so no questions? You're welcome, Kelly. Oh, Cassandra, yes, we are praying for you. Everyone, send positive thoughts to Cassandra. She takes her test tomorrow. Keep us updated. I'll be back on Sunday for anybody who wants to do another review. And Sunday's review will be CNA, and I'll probably make it just a general CNA practice test. I don't do private mentorship for CNA. I do for my nurses and for my business classes. But for CNA, I can't do private because we have a full business that trains CNAs and other instructors. So no private one-on-one for CNA. But if you want to contact me, the email address is going to be in the chat. It's admin@fltraining.com. Remember, I am limited resource, so I cannot do private CNA tutoring, but we do have the videos. We have an online course, and we have a full building in Jacksonville, Florida, where you can come in and do hands-on skills. All right, CJ, I can't wait to work with you. The Miller fam, send me your results. I'm not as busy as I was before. So the last time I told someone to send me their results, of course, I couldn't check them because my mom was sick. So if you send them to me now, I'll be able to look at them on Sunday. Yep, you just got to send me your results. So send me your test results. All right, everybody. Let's see. I have a PCT exam coming up, and are the CNA only videos good to watch? Yes, a favorite girl named Shannon, because we're giving you the foundation. So the skills videos we have also. If you'd like to take the PCT, how can you do so? When you go to our website, we have an online PCT certification course, but you have to be in the United States. So if you're not in the United States, you would have to contact whatever agency trains CNAs or nurses to see how you can do PCT. But in our area, you can do your online certification course. They'll help you find a training site so you'll be able to do your internship. Or if you don't want to do it that route, you can become a CNA and then apply to work at a hospital. And if a hospital hires you, they will teach you that additional information that you need to become a PCT without you taking a certification course. Let's see what other questions I missed. Good questions, everybody. Let's see. I took my test a week and felt within 3 points. Oh, that's okay. Do not give up, Vive. I've already 3 times. You took it 3 times. I'm so sorry to hear that. So I'm not sure what state you're in, but for our state, for Florida, if you take your test 3 times, you got to go to school all over again. So hopefully it's different where you're located. Oh yeah, Shanna, just watch our videos. 50 questions in New York. We have probably 50 different practice question videos. And if you go to our website, fltraining.com, we also have printable practice tests for free. And it's going to be like halfway down the page. You're welcome, Bars. What time will we go live on Sunday? Probably about I'm going to say 6 o'clock, Mila. Vive, before you send me your test results, I need to know your requirements for your state. Because again, in the state of Florida, if you fail your test 3 times, you have to go to school all over again. So I don't want you sending me your test results without letting me know what your state requirements are regarding retesting. All right, everybody. I'll give you another few moments before I leave the live stream. Yes, Shanna, it's so Viva, what you're going to do is you're going to call the Massachusetts Board of Nursing or whoever gave you your test results, and you're going to ask if you're able to take your test for a 4th time. And they're going to tell you yes or no. And if they tell you no, you're going to ask, what can you do? And that's when they'll let you know if you have to go to school all over again. Oh, Mila is 6 p.m. Yes, we're praying for everybody, and I love you. And guess what? I'm out of here. You all have a great day, and I'll see you in the next video. And then for the one who wants the PCT course, you will go to fltraining.com and then look for the online PCT course, but again, you have to be living in the United States.